The first exercise, many of you have seen it now. I'm sure any of the yoga enthusiasts have seen this before. It's called the bird dog. So what we're looking for is Amanda to have a nice tabletop posture. We want a very flat pelvis on both sides, and we want her just to firm up her abs and make sure that she has a solid core. So what we're going to start with is moving the right leg and the left arm at the same time. So we're going to have her go ahead and do that. Biggest key here is that when she goes backwards, we're not too high and we're not too far to the side. So now she's co-contracting all the paraspinals along the multifidi, utilizing some of her gluteus maximus, a few of her hamstrings, and all that cross chain all the way up to the posterior shoulder. Now come on back and relax. Today I'm going to sort of do a demonstration on how we adjust Amanda. A lot of different ways to adjust. I found the most sort of comfortable for the patient, especially in this case, is to have her on her back first. So we're going to be laying your back for you. And slide your bum down a little bit. So what we're working on is increasing the range of motion through her T-spine at her costovertebral joints and at those segments where she feels most of the issue, especially right around the curve, because you're going to have a lot of tension on the convex side. Bring your knees up for me. So what we've done with her, palpated certain areas that get really tight and tender. And we take her contact, so what we're creating is increases in range of motion. So you have decreases through her mid-back. Take a deep breath in from her. Good, let it go all the way out. Good. And then come on up with me. So a lot of times that pop or the crack that you hear, obviously not your bones cracking, but the release of gas from those joints. Because those joints are restricted, we remove that restriction, increase the range of motion, restore those biomechanics, and because your body's a fluid medium, the pop is, the crack is, that's the sound that you hear when the gas escapes from that capsule. Treatment of lower back pain has come a long way in the last few years, especially from 10 to 15 years ago to how we treat low back patients now. One of the biggest things and one of the changes in the paradigms and how we attack these problems is, in the olden days, what we were looking towards is bed rest, analgesics, painkillers, opioids in a lot of the cases, and avoidance of activity. Now, a lot of times now, what we're doing, you'll find a lot of the younger doctors taking a more active approach. Clinical prediction rules have been developed now in treating lower back pain, especially non-specific lower back pain, acute mechanical lower back pain of non-neurological origin, needs to be treated with an active approach. And so we take these individuals through a specific history, physical, we create a specific diagnosis. Once we uncover exactly which structure is the problem, then we start working towards how do we sort of remedy that issue, and then what do we do to continually rehabilitate the problem. And so now, when I see a non-specific low back pain patient, what we're working towards is incorporating activity right away.